Dear viewers of iRadio, I am your host, Madrama James. In this special discussion, we are focusing on December 7th, 1987, where the General Assembly declared June 26 as the International Day Against Drug Abuse and Illicit Trafficking to encourage action and collaboration towards the goal of a drug-free world. And I'm thrilled to be joined by two esteemed guests. On my right is Dr. Simon Gore, who is the chairperson of Pharmaceutical Society of South Sudan. And just right in front of me is Dr. Martin Magwek, who is the Secretary General of South Sudan Pharmaceutical Society. Good to have both of you. And let me kickstart the show by inviting in Mr. Chairman. In your own opinion, how should International Day like this influence national policies and community actions in South Sudan? Welcome.
Thank you for hosting us and giving this opportunity to share in such important occasion with our citizens to learn about what is happening on this day of 26th of June. It's really very important. This day has not come out of vacuum. It is through out seeing the effect of those drugs upon the citizens globally. That's why the international community took lead to make sure that these things are addressed and to minimize the risks that these drugs are really contributing to the world and affecting the productivity of our citizens. It's really very important. Once an agenda has been picked by the international body, it pick attention of the countries to put much effort and also to incorporate them into the national policies, which will ease the implementation and reduction of this illicit trafficking and abuse of drugs in the countries.
Now, as we dived into our conversation deeply, what are some of the examples of drugs that are abused, more especially in South Sudan, in your own research?
Yeah, commonly, actually, upon what we are seeing nowadays in our common citizens or the streets of the country, we have most commonly used the tramadols, and also you have the cough syrup pretext with codeine misused, and we have even the benzihixol drugs, they call it 5. These are commonly being abused, although there is other drugs injectable like the pethidine and morphine and some of these powders. They call it the ice nowadays, and also some amphetamines. These are the commonly drugs that are available or being misused by the common people in the country.
Well, it's my turn to now invite the Secretary General, Dr. Martin. Welcome on board. What are your thoughts on this particular International Day Against Drug Abuse and Illicit Trafficking? Welcome.
Thank you, iRadio, for hosting us and remembering this important day. Actually, this day is a crucial day, especially for country South Sudan, that has actually been struggling with a lot of issues regarding pharmaceutical management and the consumption of medicine in general by our community. I think this day is very important and is a reminder to our policymakers and to our government to put more efforts in trying to curb issues related to medicine abuse and pharmaceutical abuse. We have been seeing in the past 2-3 years the uncontrolled way these medicines have been abused by young people, which has a negative indicator on their life and also in the development of the country. My chairman just talked about tramadol. It's a huge problem that needs attention from our government, because when the lives of these young people are being put into jeopardy because of mis and abuse. It's a huge loss to the country, and we're losing a generation that we believe is the future for our country.
Well, you sound like there are really issues on ground. Now, what are some of the main challenges faced by Pharmaceutical Society of South Sudan?
Currently, this society is an advisory body. We are on ground and we know a lot of things that are happening. We have a lot of challenges, such as funding. We need to work with the stakeholders, because as a body we cannot operate alone. We need agencies, we need other bodies to work together and try to curb such challenges. Other challenges are related to capacity. We need our members to have a better capacity building activities, such as scholarship, such as other workshops and other kind of trainings. Of course, we'll not be able to say all of them, but we have a lot of them.
Well,
Yeah.
you talked of funding issues and capacity training. How are you working to address some of these challenges effectively to improve that drug regulations and abuse prevention in the country?
As a society, we are not being keeping quiet. We talk to our government. We alert them that this issue is happening, because we participate in policy making, but we don't implement. We are not policy implementers. It should be the government. But we have been talking to the government that this thing needs to be done this way. We need to do this. We need to do that. So we are doing our best as a society to ensure our community and our society gets actually the best pharmaceutical care as much as possible. This is our goal and this is our aim. We invite other stakeholders to support us in quest for ambition and the goals.
You talked of some other recommendations the society have so far presented to the government. What are some of those key recommendations before I invite in Mr. Chairman?
We are requesting our government, especially the departments of Drug and Food Control Authority, to take this issue of drug abuse critically, because it may affect the users, but it also affects us in other way around as a community and as a country in general. We request our government to put more efforts and to control this medicine from getting to the market. And even these days, you'll be surprised to hear that tramadol is being sold at the supermarket. You know, it's not right, because a controlled medicine, it should be in the pharmacy, which is licensed, and it should be given out by somebody who knows the use. Unfortunately, it's everywhere. You know, somebody who does not even have the knowledge of what tramadol is there to give it out to somebody to go and abuse it. So we request our government to put more efforts so that we save our young generation. Mostly now the young people using it to save our future, save the generation to come.
All right, Mr. Chairman, Secretary General talked of a crucial issue that tramadol is found everywhere within the residential street. First question, who is really licensing some of these drug stores, operators, and at the same time, does the Pharmaceutical Society of South Sudan inspect some of these drug stores?
Thank you, actually, for this important question concerning the licensing of the pharmaceutical outlets, or those who are responsible for dispensing of those medications to our citizens. You see, in terms of licensing, the Drug and Food Control Authority Act 2012 stipulated it very clearly, the roles of licensing. We have like 4 types of license. We have license A and B, that is manufacturing and wholesalers, distributors are under the Drug and Food Control Authority. And then the licensing of pharmacies and drug stores are under the State's Ministry of Health. They are the one giving the license to dispense those medications. So getting drugs into other outlets that are not recommended to dispense them These we call it either it comes leak out from the companies, or people import them illegally to the country, because all the wholesalers or the distributors are supposed to give drugs to the licensed facilities by the State Ministry of Health or the Drug and Food Control Authority. No drugs is supposed to be sold to any person without a license from the State Ministry of Health or the regulatory authority. So these are the two institutions that are responsible for giving out the license for the facilities. And in terms of inspection, as pharmaceutical societies, we are not the one doing the inspections to the outlets. It is the same institutions that license them are the one giving. But as the SG has put it, Dr. Martin, we can participate in the planning and of this inspection with the advice, but carrying out this solely will be the responsibility of the government regulatory agents. They are the one carrying out the inspection of both the items and the facilities within the areas.
Well, we have seen some of the negative impact of, for example, tramadol. And in your own opinion, what measures should be prioritized to strengthen coordination between the pharmaceutical society and the drug regulatory authority as well?
Yeah, to strengthen that, actually, we need to have more coordination meetings, and also to plan how to cap all this, because it's really become a national concern. If you have seen even the State Minister of Health, recently even the Central Equatorial State Minister of Health, they issued in their security meeting, they raised a concern which came into our notice through the media also, that these drugs are affecting the young ones within the state, and even they are directing the Minister of Health to do something on this. So we need to come with the mechanism of how these drugs should be restricted only to the pharmacies. Registered pharmacies are the one to handle them.
What are some of those mechanisms, for example?
The mechanism is, first of all, getting these drugs from the wholesalers. As I stated, should be through the license, and the pharmacies, registered pharmacies, should be the one responsible for this, because these are the controlled drugs. And even within the pharmacy, not everybody inside the pharmacy should be entitled to dispense them. It should be solely the responsibility of the registered pharmacies or supervising pharmacies, and then they should keep the records. Where are they getting the drugs from? The invoices that they are using for getting the drugs should be kept for review, so that we know that really they are getting it from the legal source, and then easily can be traced. Other than that, of course, we will know that now, if you don't have the proper mechanism for keeping the invoice or dispensing drugs, that means you are one of those actually contributing to the downfall of our society and the young ones. So this, by this, it will be able to at least reduce the tendency of actually getting these drugs anyhowly within the country.
Well, we are almost coming to the end of our conversation, but allow me to invite Dr. Martin, who is the Secretary General of Pharmaceutical Society of South Sudan. How can the society contribute to raising awareness about the dangers of drug abuse and support the nation's efforts towards a drug-free society?
Well, pharmaceutical society, as I just said, plays crucial role, particularly when it comes to the management of pharmaceutical services. They are actually the chief advisors on the use of medicine, medical supplies, and in general the medicine. We still believe in our policy as PSS that we can play a huge role through collaboration, especially with the partners such as United Nations, other partners, government agencies, and other important bodies such as Drug and Food Control Authority. Through collaborative work, sitting down, identifying the problem, what the problem is, and forging the way and coming up with a solution. I do believe when we work with these agencies, the society would be able to, make it voice clear and loud to the community, to the society. And as I said earlier, we will not keep quiet as a society, because these are our communities, this is our country, and we also request collaborative work with the government to listen to us, to what we say, because I believe the issue of drug abuse is a national crisis as we speak. Myself, I do believe, because when you go to, not within the Juba year, even outside, as our chairman said, in WOW, last week they declared that the tramadol should be only given out by the licensed pharmaceutical company or the pharmacy, because they've seen it's a crisis itself. And as such, we want to work with our government, and our government listen to us as a society, that you need to put more efforts in combating such issues.
Well, finally, from your side, this particular day is to encourage actions and at the same time collaboration towards a free drug world. Now face the camera and have, of course, your message to the public who are currently watching.
My message will be very brief. We are now in a crisis, especially the misuse of drugs, not only tramadol, other psychotropic medicine are there, such as morphine is also used. We have other injections such as pethidine. I request our society and the wider community of South Sudan that before you obtain a medicine, make sure you take it from somebody who knows or somebody who has been licensed, such as pharmacists. And of course, we are in a society where everybody wants to practice pharmacy, which is not right. We believe when you listen to what the experts say and professionals, our life will be safe. When we talk about tramadol, that we need to carve, trying to control this medicine is for your own welfare and for the welfare of our mothers, our children, and the future generation. So, and young people, we have a better future ahead. Tramadol is not a medicine you can actually get addicted to. You need to get rid of it. You need to think of other ways you can, try to help yourself and try to be a better citizen of the country. When you misuse tramadol, it doesn't only affect you, it also affects me, it affects our wider community, because issues related to fighting, say, insecurities and other issues may arise when we misuse this. So our message on behalf of the PSS is that we need to use medicines properly in order not to harm us biologically or physically.
Thank you so much, Dr. Martin, for sharing your thought with us, and over to you, Mr. Chairman, Dr. Simon Agore. On this particular day, what would be your central message to those who are watching us as you face the camera?
Yeah, thank you, dear viewers and iRadio, for giving us this opportunity to educate our viewers and citizens about this vital role of drugs in our society. I really concur with the message SG put it. Drugs are not food, and these are poisonous substance. They have been used with effect of trying to treat someone or alleviate some pain that is affecting our bodies. So it's always good to resort to the experts on drugs, and don't take drugs just because someone is taking, because most of the effect that is affecting our society nowadays is the peer pressure, and maybe your relative is taking this and having the same pain, and also you want to take the same. Others become addicted after treatment. So it always to adhere to the instruction of the doctor about the medicine, and then don't keep drugs at home. Especially those drugs should not be kept at home unnecessarily, because others will feel like they want to try to use it. So let us adhere to all the advice and keep our society free of all this kind of misuse of drugs through cooperation. Let us cooperate with our expert, the pharmacists, and all the health workers in terms of drugs. Thank you very much.
All right, as dear viewer, you can see the background is so busy. We are at the 10th East African scientific conference happening right here, and at the same time there's also international exhibition happening right here. And I would like also in a special way to thank Dr. Simon Gore, who is the chairperson of Pharmaceutical Society of South Sudan, and at the same time Dr. Martin Magwek, who is a Secretary General of the same society, which is Pharmaceutical Society of South Sudan. With that, one thing you need to know, you have a role to play, take action and collaborate with the relevant authorities to make sure that the world is free from drug. With that, we have come to the end of our conversation, and I've been your host, Madrama James. Pleasure being with you.